is a superpower in the world of sports. Because without movement, without motion, no sports are possible.
Yes.
Sports physiotherapy, this is something different. I know that physiotherapy is a really vast field.
Yeah.
A physiotherapist, especially for the sports world. A sports physio. That is what everybody is curious about.
Right. That time cricket was like God. Everybody used to play cricket. So after becoming a physiotherapist, my more inclination also was towards sports injuries. Physio with the Gujarat Ranji team held in 2007-8. I was selected as a physio personally by Ajay Gaekwaad sir. They don't want people to get injured. No doubt, if they are injured, we are here to help them and treat them and get back to the game. How the AI can help us to go more deeper, which will help us to enhance our practice.
The decision is ultimately the doctor's.
Yes. Contact the physiotherapist as early as possible, and especially the skilled physiotherapist, so that you get the best results.
VQ Podcasts, the only podcast where you can broadcast your USP and your expertise. Namaste, Namaskar and hello. Welcome to Vivid Vibrant Voices, the VQ Podcasts, the only podcast where you can broadcast your USP and your expertise in a fun manner and make sure you reach that audience which you want to connect with. Thank you for tuning in from all over the world, whether you're watching a meme or whether your Wi-Fi is on the slow. Today, we have joining with us somebody that you can say is a superpower in the world of sports. Because without movement, without motion, no sports are possible. So yes, today I have with me Dr. Dipak Shah, a physiotherapist specially for the sports world, a sports physio. So welcome Dr. Dipak to VQ Podcasts.
Thank you very much, and I'm very grateful for a wonderful introduction of mine related to the sports physiotherapy. Thank you.
No, we have heard so much about you. I think you have been with the ICCI also.
Yeah, I've been physio with the Gujarat Ranji team, and I got the opportunity to work as a physio with the ICC Champions Trophy, which was held in 2007-8. So that is the opportunity.
So you must have hobnobbed with all the cricketers which are in the memes today. The ones who are coming for the Gujarat Titans IPL, which is just going on.
Yes.
They lost one, I think, and the memes have flooded the market right now.
Yes, at that time IPL was not launched in 2007-8, and I was selected as a physio personally by Ajay Gaekwaad sir, late Ajay Gaekwaad sir. And I've been physio with the Ranji team and all the teams of Gujarat Cricket Association. And we had a practice match with the West Indies team and Australia team, South Africa teams. Like I've been sitting with Lara, Gail and all when we had a practice match with them also. So it was a wonderful experience being as a sports physio when I was with the GCA in 2007-8.
So sports physio, I've heard of physiotherapists. In fact, I've interacted with quite a few physiotherapists.
Mm-hmm.
Some physiotherapists are doing medical tourism. There are some physiotherapists who are acting after cancer, post-cancer.
Mm-hmm.
There I have come across some which are only doing spinal cords.
Mm-hmm.
And there are some which are doing just for lungs.
Mm-hmm.
So I know that physiotherapy is a really vast field.
Yes.
But sports physiotherapy, this is something different.
Mm-hmm.
So what are your qualifications? How did you come to become a sports physiotherapist? So when did you pass out? How many years of experience? That is what everybody is curious about.
Right. So I got my graduation done in 2002, and then I started my clinical practice in 2003 in Himalayan Arcade, Vastrapur, and the name of my center is Help Us Center. So I was from the childhood very much passionate towards sports. I used to play cricket a lot because that time cricket was like God. Everybody used to play cricket, and I had an inclination towards biology, and so I became a physiotherapist. So after becoming a physiotherapist, my more inclination also was towards sports injuries, and that time only general physiotherapy used to be there. But somehow I got contact with the psych coaches and all, and when we discussed related to sports injuries like meniscus injuries, muscle injuries, ligament injuries, I started developing more interest toward the sports injuries and treating the sports injuries. So that journey started from 2003. Then in 2007-8, I was selected as sports physio for the Gujarat Ranji Trophy team and all the teams of GCA. Then I got level 1 trained physio by the BCCI under John Gloucester, the physio of Australian team. And in 2020, I was selected as a sports physio for the Surrey Jaguars team. of
Wow.
Canadian Premier League. And last year I worked as a sports physio with the Last Miles Cricket Carnival, which was the biggest tournament held in Ahmedabad, the Sardar Patel Stadium. And I have done my continuous skill upgradation related to the sports physiotherapy.
I basically, when I was reading through your bio, what I really struck me basically was that you have propagated hands-on. Now, I have been watching a lot of these science programs,
Yes,
and
yes.
I have noticed that many of the physiotherapists have started using machines
Yes.
and
yes,
to
yes.
assist them in giving, physiotherapy.
Yes,
But
yes, yes.
what struck me in your bio was that yours is hands-on. And not only that, you say that it's international hands-on.
Yes.
That you have learned some of the techniques from outside India.
Yes, yes,
And they are
yes.
specifically related to sports.
Yes.
So throw some light on that, sir.
Yeah. So when I started my practice, that time only electrical machines and therapies were going on. I used to give electrotherapy treatment to the sports injuries and general orthopedic conditions. After 2010 and 12, there are new structures which are being discovered in the body, and those structures are regulating the body. So if we want to treat any sports injuries, these are the structures which we need to target, and they are reacting more properly to the international hands-on physiotherapy. So I have done my major skill upgradation from the international physios from UK, USA, Italy, and I have learned many international skills like dry needling technique, acupuncture technique,
Dry needling.
Western dry needling technique, medical acupuncture technique, ISTM, which is a particular tool, patented tool, which we slide on the body to release the tight muscles. Then we have BFOT technique to strengthen the muscles as soon as possible. Cupping therapies I have.
Tell us a little
taping
bit more. I
therapies.
have heard about cupping therapy
Yeah.
and dry needling, but give us a little bit more insight as to what exactly happens when you do dry needling.
See, dry needling is considered the king of hands-on therapy. It's the number one therapy which gives us the best results.
For what? A relief in pain or
Yeah.
actual strengthening
so
a
what
muscle?
is our goal? For example, our goal is for pain relief. Then we have to do dry needling according to that. If our goal is to release any tighten structure or tighten joint, then we use the dry needling technique according to
So
that.
you use needles?
Yeah, we have a dry needle of different sizes, which we insert in different angles in different muscles or the joints to
It's
get the
invasive.
desired result. It is an invasive technique.
So the needles must be sterilized or
See, it's
disposable?
Yes,
or-
they are disposable, single time use. We do not use it again. We open it in front of the patient, we use it, and then we discard it to the biomedical
Alright, so it's
waste.
a safe procedure to go in
Extremely
for.
safe procedure, and the best results we get with the dry needling technique.
And this you learned from which country?
I learned it from India, but from an international instructor.
Okay. And what about cupping?
Cupping also same. International instructors usually come to India to teach the physios.
But what happens in them? What do you do?
So cupping is like, what I can say is like it creates a negative pressure. When we put a suction, it creates a negative pressure so that the toxins from that particular area are removed and the healing starts. So we have different kind of cupping therapies. We use essential oils with soft cup. Then we have wet cupping therapies where we make superficial cuts in the body and we drain out the impurities and the blood from there. Then we have ice cupping. Then we have glide cupping.
And all this in sports people.
Yes, mostly all these are sports people and orthopedic conditions. So in sports people, you must have seen Michael Phelps when he has done cupping and he used to go for a swim. The cupping marks are there on his back. So cupping became very famous after Michael Phelps
Showed the world that
I'm doing cupping.
All right. No, very true. Now, I have understood that athletes, most of them, they have three kind of needs. Either they want to strengthen their muscles
Yes.
so they can perform well, or they're already injured and they want to repair the injury. Or third is before going into any sports or entering the sports, they want to make sure that the parts which are related to it already are strong enough to take any kind of beating and not get injured. So these three different phases, do you have different regimes for that in your setup, or do you have different physiotherapists under you, or do you the training for all of them personally?
No, since 2003, I am treating all the patients on my own. I am not using any junior physio who will come and give the treatment. I am the only person who is treating. And right now I take only 10 to 12 patients in a day and I treat them personally. So almost in 20 plus years of careers, I have treated more than 30,000 patients, all personally with my hands, not using any junior physiotherapist, because certain hands-on skills are precision-based skills. We cannot give somebody who's not certified who is not experienced and hand over him. You can
And then
do it.
expect them to give the kind of results which
Yes,
you are promising.
Yes, exactly. So I only use the techniques. Physiotherapy has a very huge role in treating as well as in prevention. So once we have treated a condition, the patient is almost 80 to 90% ready to go to the sports. We teach them certain preventive exercises, certain preventive tips, which he has to follow so that he again doesn't land up with the same issue. So we don't want the patient coming to me again with the same conditions. Once he's treated, we give them proper home protocol so that he follows that and doesn't have the same condition again.
All right. I had done a small podcast with about 4 or 5 physiotherapists about software.
Okay.
So, and the current use of AI and technology with physiotherapy. So, are you also using it?
AI is like an helping hand. It cannot replace any doctor. It is like an helping
course.
hand where we can have more insightful related to certain conditions, how the AI can help us to go more deeper, which will help us to enhance our practice and we can practice with more better. And software is also good. We are maintaining electronic medical records.
It's easier to keep in touch with patients.
Ecadoc and appointing 2 softwares. I'm using it where I can give the proper instruction to the patients, what he has to do at
Home protocols.
home protocols and everything. And the certain amount of conditions, his medical records, we can take a pic and store it. So once the patient is coming after 1 or 2 years, we'll have
still
the
have the
records.
history
Yes,
as
yes.
to what worked at them.
Yeah. And it helps to the patient. Recently, I had a patient after 1 year, she asked me, can you send me the MRI photo of me? I wanted to claim the money from the Mediclaim. So I gave it to her and she got almost 5,000 rupees back from the Mediclaim company, which she had lost. So electronic medical records are very important so that it can be helpful for them in future also.
Not just you, but even the clients themselves.
Yes.
I have also seen, I have been to a couple of physiotherapy clinics from my podcast point of view only. And I have seen that there are huge machines which are being operated by the computer and a physiotherapist is sitting manning the computer, but the patient is suspended on the machine or the patient is actually sitting on the machine. And I think for urinary incontinence, something like a commode was there and you're sitting in it and it is doing something to the muscles. So everything is done by the computers. So I'm talking about that kind of AI interference. So do you think AI will replace you in the future or do you think it is just an adjunct?
No. AI is like an helping hand.
Like you said.
Yeah, it is like going to help us how we can improve our practice, but we only have to practice.
Exactly.
It's not like that AI will be doing everything on behalf of us.
No, the way these machines were there and I mean.
But machines, we have to enter the program.
Somebody has to do it.
Yeah.
And
so,
which one to choose?
Yes. What is your personal condition? Urinary incontinence is a medical condition. We have 15 patients of urinary incontinence, for example. Every patient needs a different protocol. We cannot put everybody on a same protocol.
I even saw a man who had met with a very bad accident and almost every bone in his body was fractured. He was suspended from something which was 10 times his size.
Yes.
And they were making him use hand and which was physically not possible for a human being to do.
So,
but it was assisted by the machine. But like you said, the machine was being fed with information by a doctor.
We have to put a proper information inside and that the machine will according to that only. It's not like that we'll put the patient and machine will decide everything.
The decision is ultimately the doctor's.
Yes, that this has to be done like this. We have to be totally inside it. The machine is a helping hand, as I told earlier.
Out of all the kinds of physiotherapy that you're meeting out, which is your favorite? Which is the one which you feel is you love doing it? It's making a difference in your patient's life.
Yeah, so mainly I love treating post-operative physiotherapy after arthroscopy because once your ligament or muscle or meniscus is totally broken, then it is very difficult to cure it from outside. You have to compulsorily go under an arthroscopy procedure. Arthroscopy procedure is a one-day procedure. You get your surgery done, next day you're discharged. But now you are a sports person. You want to again go back to the field. You want to play cricket. You want to bowl fast. That time you need a very good physio to make you go back to the field. So I have all the skills related to that, which will help you to go back to the field as soon as possible with the same power, maybe more better power, which you have, which you had before surgery.
So it's not just sports physio which you're giving, but even orthopedic physio, because obviously there's an intervention of an orthopedic surgeon whenever there is meniscal injury. So though it's related to sports, it's basically an orthopedic surgeon. So you are practicing both sports physiotherapy as well as orthopedic.
Sports and orthopedic conditions are cousins.
Almost similar, okay.
So everything is musculoskeletal. which we combined it as sports and ortho. But a common word is like musculoskeletal conditions.
So this involves any joint of the body? It
Yes.
may be the knee, the shoulder, the hip.
Knee, shoulder,
It depends
hip,
on
ankle.
which sports you're playing,
Yeah,
whether it's
yeah.
a hand sports or a
Yes,
foot
yes,
sport.
yes. Any sports may have a different kind of injury. Certain joints are more in cricket. Certain joints are more in badminton or in tennis. So it depends upon the injuries and.
I've heard of the tennis elbow, which
Yes,
is a very,
yes.
very serious thing. And I have heard that it is, once you get it, normally the people don't go back to the game because the pain is so bad.
Yeah.
And physiotherapy also doesn't work very well in it. Is that true?
Physiotherapy only works very well in tennis elbow.
It does?
Yes.
Okay.
Because anti-inflammatory drugs will help you to relieve the pain to a certain extent.
But it comes back.
It
That's
comes
what
back,
most
yeah.
patients.
But if you want to cure it, so the curing is only possible by physiotherapy, which will help you to reduce the pain, reduce the inflammation, increase the blood supply of that area, and then we can strengthen those muscles and again you can play. Unless it is of very bad condition, like Sachin had a very bad tennis elbow and he extended it till it became totally black and ruptured. Then he got surgery and then he again did physiotherapy and came back. But when you are in the initial stage of tennis elbow, grade 1 or grade 2, physio is the only thing which will help you to go back and again recover and play back the game you want.
So this is all about injury. Or, when you're playing sports, you got injury and you're getting it recovered.
Yes.
What about the young people of today who are actually wanting to enter sports and they're careful? Today's generation is like that. They like to go into a place which is safe. So when they are careful, how can physiotherapy help them so that they don't develop only any injury?
Yeah,
There's no question of it.
Yes, yes. So that thing we always give a knowledge to each and every patient that we don't want people to get injured. No doubt, if they are injured, we are here to help them and treat them and get back to the game. But the prevention part is also equally important, that when you're playing any game, before the game, you should do proper warm-up. After the game, you should do cool-down. You should do regular exercises for the sports which you are planning to play. It is not that Sunday to Sunday you are just playing and you are not working on your fitness and nutrition. Then you are having high probability to get injury.
Okay.
So better make your body fit, have proper nutrition, and then you play the game, then the injury chances are less. But what I have majorly seen in domestic or local people, they Sunday to Sunday, they play like hell and 6 days they are just working in the office. So those people are having more probability.
So a regular exercise every day and guided by a physiotherapist to strengthen that muscle which you are using maximum during the sport.
You need the strengthening your muscles properly. You need to take proper protein intake, proper fluid intake.
So you have in-house dietitians and
we have a dietitian nutritionist in our center also, which can guide you properly. And certain basic nutrition guidance also I can directly give
So
to
it's
the
a combination of things. It is never standalone.
Yeah, because you cannot develop a muscle if you don't put a nutrition inside. If you are doing any exercises and you want to strengthen the muscles, you need a good amount of protein intake, rest, a good amount of nutritions and supplements. So that is all required to strengthen the muscle. It's not that just doing exercises will develop the strength.
Okay. So that's a good message for the youngsters
of today. So we give parallelly the same when they come for strengthening part post-surgery also, because the muscle becomes very weak. So the nutrition part is also equally guided so that the best results in the less period of time.
How many centers do you have, sir?
I have only one center.
And you are the only person practicing there?
Yes.
No junior physiotherapist to assist you?
So I have only one center, though earlier I had patients only from the Vastrapur area when I started practice. Now I am getting patients from all over Ahmedabad. Even I have patients coming from Calcutta, Mumbai, and outskirts of Gujarat, where the physiotherapy equipments are not the skilled, physiotherapists are not that much of skilled, or they don't have equipment from the rural areas. And my patients who have gone through physiotherapy with me, and if their relatives are in another state, they call them particularly here, you come here for a month or 15 days, get yourself treated and go back. So I have practice like almost coming people from
all over India, you can
all over
say.
India and all from all over Ahmedabad.
And with all this other external treatments that you're giving, which I don't think all physiotherapists offer.
Yeah.
Like
so usually in conventional therapy, what happens if you are coming for say any sports injury of ligament or a muscle, 10 days they are giving you the same physiotherapy. When you come to me, 10 days I am giving you different physiotherapy skills, not the same. So when they have experienced something different and what they have experienced unconventional, then they will understand the difference. That here you would get 10 different skills in 10 days. and then conventional people are giving the same physiotherapy for 10 days. So the benefit you will get here is different, 10 times more, because daily you are experiencing new skills. So they have an anxiety when they come, what I am going to get today. It's not the same thing what you are to get today.
No, I understand. And I think this is really very good news, especially for those people who are either starting their sports journey or who are in the process and already hurt or not wanting to get hurt. So all three spheres are being taken care of by you, and not just by physiotherapy, but all the additional hands-on international therapies that you've learnt about. So I would say that any sports person who wants to run faster than Dhoni's helicopter, which I think he's just bought, then probably faster than our Wi-Fi's in our airports, that too. But I think they will need you, or at least to connect with you. So before we end our conversation, I would like you to leave a little message, not just for the sports people, but for the general public, as to what to take care of so that they don't need you. And if they need you, how long to wait or not wait, which can cause some irreparable damage, which even you can't cure. So if you have a message for our listeners, please do address the audience.
So whenever you have any kind of sports injuries, don't try to extend it. If you have any kind of symptom of pain, swelling, or lack of mobilization, please immediately consult the physiotherapist so that I can cure you as soon as possible. Because we have certain patients coming to us after 2 months or 6 months after injury, and it becomes very challenging for us to treat him and bring him back to the game. So contact the physiotherapist as early as possible, and especially the skilled physiotherapist, so that you get the best results. That is the message for the general population, what I would like to give.
Thank you very much, Dr. Dipak. A very enlightening session. I'm sure I learned a lot, which I didn't know. So I'm sure our listeners have had a lot to learn from our conversation today. And we hope to keep hearing from you and upgrading yourself as you do, so that there are new modalities that we hear about which can help in sports medicine. So thank you once again. And thank you for joining us at Vivid Vibrant Voices, where you have a little bit of fun while describing your own expertise, your own USP in your own voice. Till we meet again next week with another interesting guest. See you.